All right, welcome to lesson 7.2. Talk more about the kidneys. So, pathological conditions of the kidney can be glomerulonephritis. You got to say that slow, right? Interstitial nephritis, nephrolithiasis, and nephrotic syndrome. Also, polycystic kidney disease, or PKD. That is when the kidney contains masses of cysts. And normally, so polycystic kidneys will weigh 20 times more than their usual normal weight. So here's a kidney covered in cysts. Pyelonephritis, renal cell carcinoma, renal failure, renal hypertension, and Wilms tumor. Here is a renal cell carcinoma tumor right here on the kidney. And then as far as the urinary bladder goes, pathological condition would be bladder cancer. And then associated conditions with kidneys are diabetes insipidus and diabetes mellitus, DI and DM. Okay, so what do we think a term that means frequent voluntary urination at night is? So that means that we have control over it. So it's not uncontrolled or involuntary. Would it be anuria, nocturia, diuresis, or hematuria? So I bet you guys can figure that out, right? Anuria would mean, A means without, so that would be no urination. Diuresis is, it is frequent urination and elimination of excess water. And then hematuria would be blood in the urine. So noct, meaning nighttime, would be nocturia. Hopefully you guys got that right. Okay, so common laboratory tests run to check the function of kidneys would be blood urea nitrogen, or BUN, and then a creatinine clearance test. Clinical procedures that could be done would be x-rays, so a CT urography. You can also take a look at the kidneys, ureters, and bladder, KUB. You can do a renal angiography, a retrograde pyelogram, and then a voiding cystourethrogram. So that would be while urinating, while voiding. So here's a CT scan. CT stands for computed tomography. And this scan is using contrast to show a benign cyst on the kidney. So here's the kidney. This is looking down. A slice, it's pretty much like if you cut somebody, sliced them in half, and this is looking down on top of the kidney, and here's the cyst right on top. It's pretty big. The voiding cystourethrogram, VCUG. So this is showing a normal female urethra, and the bladder is filled with contrast material, and then we follow it all the way through with x-ray imaging. So we can see it empty from the bladder through the urethra and then the urinary meatus to look for any abnormalities there. Clinical procedures. Could do an ultrasound exam, an ultrasonography, imaging the urinary tract structures using high-frequency sound waves, radioactive studies such as a radioisotope scan. This is an image of the kidney after injecting a radioisotope into the bloodstream, so we can follow that radioisotope all the way through the bloodstream and then filtering through the kidney to see if there's any issues with how things are flowing through there. Magnetic imaging, so MRI, magnetic resonance imaging, can do a urography. This is changing magnetic field produces images of the organ and the surrounding structures in 3 different planes of the body. Other clinical procedures would be a cystoscopy, dialysis, lithotripsy, renal angioplasty, renal biopsy, renal transplantation, and urinary catheterization. So the cystoscopy is a direct visual exam of the urinary bladder with an endoscope. So a little wire is threaded up through the urethra, and it's got a camera on the end, and so they can get a direct visual exam of every structure through there. Hemodialysis, or HD, that is when somebody's kidney is not able to do the filtering on its own, and so people get hooked up to HD hemodialysis machines, and that does the work of the kidneys for them to filter out all the waste products. Continuous ambulatory peritoneal dialysis. So this is CAPD. This is another way of performing dialysis. So the dialysis solution it goes in through a catheter and then comes back out through a draining catheter. So our abbreviations that we talked about are ADH, AKI, ARF, BILI, BUN, CAPD, CATH, CCPD, and CKD. So we need to make sure we know what all of these stand for. Okay, so I realize I should probably define all of those for you. So ADH stands for antidiuretic hormone. AKA is acute kidney injury. ARF is acute renal failure. BILI, or Billy, it can be either bilirubin or also often the Billy Light is used on newborns who are experiencing jaundice. BUN, remember that's the blood, urea, and nitrogen. CAPD, so we just looked at that. That was the continuous ambulatory peritoneal dialysis. So ambulatory means that the person can walk around. And then CATH, that's short for catheterization. CCPD is similar, right? So it's continuous cycling peritoneal dialysis. So that's when the person's actually hooked up to a machine and is unable to ambulate. So that's the difference between those two. And then CKD is chronic kidney disease. Oh yeah, there you go. There's all your definitions right there for you. So we'll skip this one and go to the next one that has the definitions. Cl stands for chloride, which is a kidney excretion. CrCl stands for creatinine clearance. CRF is chronic renal failure. Remember on the previous slide we had acute renal failure. So remember the difference between chronic and acute would be if something has been present there for 3 months or more, then it goes from being acute to chronic. A CNS, that's a culture and sensitivity testing. Cysto is short for cystoscopic exam. eGFR is the estimated glomerular filtration rate. ESRD stands for end-stage renal disease. ESWL is extracorporeal shockwave lithotripsy. HCO3 is bicarbonate, an electrolyte that's conserved by the kidney. HD stands for hemodialysis. IC is interstitial cystitis, which is a chronic inflammation of the bladder wall. IVP is intravenous pyelogram. K plus stands for potassium, which is an important electrolyte. KUB is kidney, ureter, and bladder. Na plus is the chemical abbreviation for sodium, another electrolyte. PD stands for peritoneal dialysis. pH is the potential of hydrogen. This is the degree of acidity or alkalinity. PKD is phenylketonuria. SPGR stands for specific gravity. A UA is a urinalysis. A UTI is a urinary tract infection. And the VCUG, remember that's the voiding cystourethrogram. Okay, so what does the abbreviation RP, which one is it associated with? Is it fluid, when fluid is injected into the peritoneal cavity and then drained out? Is it when contrast is injected into the urinary bladder and ureters and x-rays are taken of the urinary tract? Is it when nitrogenous wastes are removed from the patient's blood? Or is it an electrolyte as secreted by renal tubules? Let's see. Correct answer is B. That's the abbreviation for retrograde pyelogram, RP. Okay, so let's look at the combining forms now. Albumino, which means albumin or protein. Angie or angio is a blood vessel. Azot or azoto is urea or nitrogen. This is review now from the last lesson as well, right? Bacterio, chelio or chelicio, cysto, dipso, glomerulo, glycoso, hydro. Isk or isco means the back or to hold back. Cal is the K, stands for potassium. Keto, ketano. Litho, meato. Natro, necro. Nephro, nocto, oligo. Pio, piello, reno, trigano, and uro. And ureter, urethro, urino, and vesico. Here's our suffixes. Ectasis is stretching and dilation. Ectomy, removal or excision. Emia is a blood condition. Esis is just a condition. Gram, remember that means a record. Or lithiasis is a condition of stones. Lithotomy is the incision for removal of a stone. Lysis means to break down. Megaly is enlargement. Oli is little or small. Osis is a condition. Pathy is a disease. Plasty is surgical repair. Poietin is a substance that's formed. Ptosis is a droop or sag. Rhea means flow or discharge. Sclerosis is hardening. Stomy means to create a new opening. Don't confuse that with tomy, which is the process of cutting. Trypsy is to crush, and urea is meaning urination. Some prefixes are a or an, which means without or not. Anti is again or against. Dia means complete. Dis means bad or painful. En means within. Peri is surrounding. Poly means many of them or lots of them. Retro is behind or in back. And the combining form dipso means what? What do we remember? We just looked at that one, right? Stone, scanty, thirst, or water. So the answer should be C, right? Thirsty. Pretty sure we just looked at that one. Yep. Okay, and which combining form means pus? pio, right? And the combining form isk or isko means scanty, to hold back, night or trigon, and it's b, to hold back or in the back. Okay, great. So that's the end of lesson 7.2.